So in this academy, as always, we acknowledge God first. We acknowledge God and we give God Almighty all the praise. So welcome back to this life quiz. Number one purpose of this is to help students answer questions fast, to help them articulate and know the right answer. And it's because it's a live session, it is very interactive. So being a live session, if you know the right answer, I want you to notify me in the comment live session. Are we together? So I want you to share to your friends, let them join the live session. So, number one question: a woman, and never you forget these are past questions, so don't joke with them. Midwives, the midwifery students, don't joke with these questions. The nursing students, questions like this do come out also from nursing students in their council exams. And I believe we've had a simplified private lecture on this, and I believe every student should not fail any question. So, number one question: a woman complains of nausea, breast tenderness, and fatigue. These are classified as A, positive signs, B, probable signs, C, diagnostic signs, and D, presumptive signs. A, positive signs, B, probable signs, C, diagnostic signs, and D, presumptive signs. Now, if you choose A, you are wrong. If you choose B, you are wrong. If you choose C, you are wrong. The right answer is what? D, presumptive sign, which I explained the reason in the private lecture room. So D is the correct answer. Number two question: which of the following is a probable sign of pregnancy? Which of the following is a probable sign of pregnancy? A, amenorrhea. B, positive pregnancy test. C, fetal heartbeat heard by a Doppler. And D, fetal movement felt by the examiner. Which of the following is a probable sign? I want you to share this to your friends. Let them join this live session. It is important you join the live session so that you will answer questions. All right? Also, drop your schools and universities and colleges. Which of the following is a probable sign of pregnancy? A, amenorrhea. B, positive pregnancy test. C, fetal heartbeat heard by a Doppler. And D, fetal movement felt by the examiner. And if you choose D, you are wrong. If you choose C, you are wrong. If you choose B, positive pregnancy test, a probable sign, or is it A, amenorrhea? And if you choose A, you are wrong. The right answer is what? B, positive pregnancy test. Because in our last private lecture room, I told you all that positive pregnancy test is a probable sign, not a positive sign. Remember our last class. All right? I'm impressed with students that are getting the correct answer. Make sure you share to your classmates so they join the live session. It is important to be in the live session. Number three, which sign confirms pregnancy beyond doubt? A, morning sickness. B, Hagar sign. C, Chadwick sign. D, fetal heartbeat heard by a healthcare provider. This one is very simple. See a question like this, you should know the correct answer. Now, if you choose A, you are wrong. If you choose B, you are wrong. If you choose C, wrong. The right answer is D. Fetal heartbeat held by a healthcare provider definitely confirms pregnancy beyond every doubt. Are we together? So D is the correct answer. And number 4, a positive urine pregnancy test dictates a positive urine pregnancy test dictates A. Progesterone, B. HCG, C. Oxytocin, and D. Estrogen. A positive urine pregnancy test dictates A. Progesterone, B. HCG, C. Oxytocin, and D. Estrogen, which is the correct answer. And if you choose D, you are wrong. If you choose C, you are wrong. I'm impressed with the students that just chose the correct answer in this live session. So the right answer is what? B, HCG. So whenever a woman is pregnant, though presence of HCG is a probable sign, but it is used to do or dictate pregnancy through what? Urine. Are we together? All this has been explained in the private lecture room. It is just a quiz to reassess our brain capacity and retentive memory. Number 5, quickening is classified as A positive sign, B probable sign, C predictive sign, and D presumptive sign. Quickening is classified as A positive sign, B probable sign, C predictive sign, and D presumptive sign. Which is the right answer? And I'm giving 5 seconds for wonderful students that want to share this. I'm going to give 5 seconds for wonderful students that want to share this. Which of the following is not a probable sign? Which of the following is not a probable sign of pregnancy? All those wonderful students in this live session, I'm so happy with you that it shows that you are following the class. You followed the last previous class for getting this correctly. Now, number 6, which of the following is not a probable sign of pregnancy? A. Braxton Hicks contraction. C. Goodell sign. C. Fetal movement seen on an ultrasound. And D. Chadwick sign. So which is the correct answer? Which is the correct answer? And if you choose A, you are wrong. Braxton Hicks contraction, wrong. If you choose B, Goddess sign, you are wrong. If you choose C, fetal movement seen on ultrasound, you are correct. So D is wrong because it's a probable sign. Chadwick sign is a probable sign. Goodell sign is a probable sign. Braxton Hicks contraction is a probable sign. So the right answer, because the question is which of these is not a probable sign, the right answer is what? C, fetal movement, which is what? A positive sign. Are we together? Yes, we are together. Now, the next question. The softening of the lower uterine segment is called the softening of the lower uterine segment is called A. McDonald sign, B. Goodell sign, C. Hegar sign, D. Chadwick sign. These signs comes out a lot in exam. The softening of the lower uterine segment is called A. McDonald sign, B. Goodell sign, C. Hegar sign, and D. Chadwick sign. Which is your right answer? Now, if you choose A, you are wrong. You can't be in the last class and choose A. If you choose B, you are wrong. If you choose C, you are correct.